Vreau să-i spun bun venit lui Karen. Ar fi multe de spus în legătură cu Karen. Ne-am întâlnit anul trecut la Congresul Asociației Dietetice Americane și a devenit un mentor pentru mine. Este extraordinar să ai o persoană care să îți spună ce trebuie să faci, care sunt pașii care trebuie făcuți și mă bucur foarte mult că este împreună cu noi. Ea este directorul relațiilor internaționale, alianțelor internaționale în cadrul Asociației, adică Academiei de Nutriție și Dietetică. Welcome.
Okay, thanks.
This is
Thank you. Well, first of all, I am thrilled to be here. As Dr. Dan mentioned, I met him just a very short time ago, last September, and we had a very long conversation about what it takes to form an association and what are some of the pieces that you need. And I gave him a very long list of things he had to accomplish, and I thought, okay, I'll maybe see him in another couple years. Well, in about 2 months, he sent me an email saying, I've done all that. And I have this wonderful idea about having a conference. And do you think that is something we could do in Romania? And if so, could you help me with some of the steps? And so that's what he's referred to in his introduction. So it's quite an honor to be here, and also to be here with all of my colleagues from all over the world who you've been hearing from this morning. They all are really people that I have known for many years, and as really people I look up to help on how you work with the international community. Each has taught me a great deal, so I thank all of them for giving me much wisdom. One of the things that I'm going to do, you've heard a lot this morning from a lot of different associations and societies, and they each have a very special group of things they're doing, but as you listened, there was also a lot of commonality. So my presentation now is going to try to summarize what is an association, what are some of the things you look at, and I also know that I am the last speaker before lunch, so I'll try to keep this light and move us along so we can have the fun stuff that will happen in a little bit. Previously, we quoted one of our current presidents, Barack Obama, but when I put this presentation together, I wanted to quote a president that's somewhat near and dear to me because I live in a state called Illinois. And Illinois' nickname is Land of Lincoln. And the reason we have that nickname is because one of the presidents of our country who had a very big job during our Civil War, his name was Abraham Lincoln. And Abraham said this quote, and I think that it's one that is so important to all of us who work in the association world, because sometimes it's hard to do this work and to get everyone to come to consensus. Easy to talk about, not so easy to always do. But Abraham gave this thought, and I use it a great deal when I'm trying to work through programs. First of all, you have to determine what do you want to do. And I think Romania did that, and they said, we want to have dietetics, and we want to have a dietetic association. And then, once you do that, you can say it will be done and we will find the way. And I think today is proof that you have found the way. A profession per se, in an overview, we've talked a lot about dietetics. What is a profession? Well, a profession is something that is built on a basis of scientific evidence-based research and principles that kind of define a body of knowledge, and you become the experts of that knowledge. So there are scientists who study animals, and they get to know all about those animals, and they become the profession that takes care. Veterinarians take care of animals. So each body, each profession has a body of knowledge, and they study it and become the experts in that. So this is what we're doing in dietetics. There is a great deal of scientific information. We need a great deal more of scientific information. Nutrition is really a relatively new science when you look at all the science that's out there and studied in the world. And so it changes a lot. People ask questions, well, they're giving this information today, there's a new study, they give different information tomorrow. But that body of knowledge is what binds us all together, no matter where we are in the world. So that's the important piece of what it takes to be a profession. So once we have the profession, how do we work together? Is it best to work individually? As individuals, we get our education, we go out, we find a job, we do our job, or do we need somewhere where we all come together and talk about what we learned on our jobs, what more information do we need, how do we come together? And this is where an association comes into play. An association is really an organization of persons with common goals and interests. Guess what? They get to define what the goals and interests are. I think earlier this morning, when representatives from the Romanian Association talked, they gave us a lot about what they've already defined as common goals and interests. Now it will become the important part of everybody in the room to how to make that happen. 2 people, 3 people, 4 people don't make it happen. Everybody in the profession makes it happen and makes the goal work together. These are some of the elements in an association. Many have already been talked about by several of the speakers, so I just bring them together as saying, yep, they were right. They picked the right things for what's important. You need to have some mission and values. You need to have members. Can't have an association without members, so that's an important thing. You need to constantly look for new members, and you have to also look at how are those people going to work together. So you probably have a bylaw or governing document, so any new member who comes into the association wants to know how it works. You can show them that, and they'll understand how their resources will be used, because in most associations, they pay money to be a member, and so those dues are worth some of the resources that they have to get the work done that everybody wants to do. I put up these mission statements, most of which you have already seen today. There's one kind of new one in there, and that's the Asian Congress of Dietetics. The Asian world is also organized, and they get together, and they're going to have a congress in 2012, and the theme of that conference will be Advancing Health Through Innovating Dietetic Practice in Asia. So I put that in just to make everybody know that in addition to international, European, Asian, is also involved in organizing and has the dietetics profession. And then because I work at the Academy of Nutrition and Dietetics, and that's my association, I put their, which Ethan had shared you earlier, their mission. Now, one thing that we haven't talked too much about today in a way, it's been subtly there all morning, is the word of values. Because that's the other thing we share in common when we're in an association. We share our identity, we are proud of our profession, the purpose, what we are doing, and how those common values will help us to build the information and recognize what we want to be. So how do we get the respect of our profession? What is the values that we have? This particular definition came from a report that was done by an organization in the United States called the American Society of Association Executives. We have thousands of associations in our country, thousands and thousands. Over the world, there are thousands. So there is an association of associations, and they come together to talk about how do you run an association successfully. So they did a report called Exploring the Future, 7 Strategic Conversations that Could Transform Their Association. And this is how they defined values. Oops. Sorry about that. Okay. Members, so we had mission, vision, values. We have members. The members are the core of what we do. The important part is the science and the body of knowledge, but it will just sit on a shelf if all of you in this room do not do something with that knowledge. So the member interaction becomes the core of how the association will achieve the purpose that we set. Those were all wonderful purposes we saw and why we want to be. But without the members getting very involved and very excited about that mission and have their common goals and also celebrate their achievements. It is so important as you work in an association to recognize each other and support each other. Some days you will be the one succeeding, other days somebody else will succeed. We have to support each other when we succeed. If we only talk about each other when we fail, we will not ever be a strong association. So it is so important that we look at our achievements and recognize those as we move our association forward. It's very important that the association defines its membership in common standards. I'm so glad Marcia just gave her presentation because she did such a lovely job in defining what is a member of the International Confederation of Dietetic Associations. How do you define that membership and how do you have a standard that those members know and follow when they join? And all the members who have joined that organization are putting money and resources into it. So how do we define that membership and know so they know whether they can be a member? So that's an important thing for the association to do so people know if they can join. Not everybody in Romania is going to want to join this association, and so who can and is important to define. I mentioned the word governing documents, and these are some of the key elements that you'd see if you read that document. This is usually where people yawn when they talk about nobody ever wants to serve on a bylaws committee. Doesn't sound very interesting. But actually it's quite such an important part because it's such the foundation of telling everyone what the organization does. So what you put in your official governing documents, and you'll see in most governing documents, is who the members are, which we just talked about. Official meetings, when do you have to have a meeting? Most governments, if they recognize an association, say you have to meet probably once a year. You have to let the members know you're going to have the meeting. It can't be a secret society somewhere, so that all the members can come if they would like. You have a board of directors and officers, people that keep the organization moving and running. Today you've seen presidents talking to you in that. They're the board of directors and officers. They work with committees. Nobody can do the work alone. So you can't say, oh, there's a board and the board will take care of the work. Well, there's too much work. So they need committees and advisory boards to get the work done. And those are usually defined. Many times there's a budget committee. There's, in our organization, we have a position committee that helps set some of our position statements and works on that. I particularly, in my organization, staff a committee called the Diversity Committee, and it looks at issues of all the diversity within our profession, as well as things as culture and cultural competence, and also things called health disparities. So that's, each organization has to look at where its goals are and then define what kinds of committees will help get that work done. Fiscal I've mentioned several times because fiscal is important. Also, there's some official things you have to write about your records and your seals. I see you have a wonderful new logo. I had not seen that before today, so that was absolutely wonderful. So it becomes kind of your official recognition, and so you have to protect that. Where is it going to be used? How is it going to be used? And then last but not least, I always put this in case things don't work out, you have to set down how you're going to break apart. We've been going at it for 95 years and never had to use our rules of dissolution, but guess what? We have them sitting there in case that should ever happen. Also amendments, because bylaws are something people like to change, and as the organization changes, so we tell people how they can do that. I also mentioned resources in that list of things that every association needs to look at. And There are all kinds of resources, and this is a short list of some that I feel are important if you are going to be a successful organization. The first one, and Ann should be happy, is Ann still here, that I'm mentioning this because it's so important that we have scientific evidence-based research as a core of any association. They need to look at research, they need to know where research is needed. Even if the association doesn't do the research, they need to know to support and encourage either the academic world to do it, the government to say we need to know more about this issue if we are going to help people live a better life. The other resource is your members' knowledge and skills. Nothing is more important than the members speaking up and saying what they're good at, so that when the association needs that knowledge and skills, they know who to go to help them in that particular kind of project. Because dietetics is so diverse, even if clinical nutrition is the main emphasis, there are so many different diseases and different ways the clinical nutrition is applied. People become experts. So whether you're working with babies or you work with children or you work with the elderly, each of those are very unique. And so when you need that knowledge, the member who has that knowledge because they're working in the area needs to be known. Another one, and I think we're going to be talking a lot about this tomorrow and this afternoon. Whoops, what did I do? I pushed the wrong, whoop, okay, there we go. Is how do we work with other professional colleagues? The profession can't work with itself. You're out there in the healthcare environment, and so it's important that you know, and many times in healthcare, it's doctors, it's nurses, it's speech therapists, it's physical therapists, it's occupational therapists. There's all kinds of other people who work in that environment. So you need to know what they do, they need to know what you do, so you can all do your job good together and you're not trying to do each other's jobs. So how you use them as resources when you're developing things in your association is important. One of the things we do at the Academy is we have on our board of directors 2 members which we call public members. Those members are picked by the board of directors and they come from all different areas. Currently we have a physician who sits on our board, and we also have somebody who is a marketing public relations person. And so he has been invaluable with helping us on how to market, especially since we have a new name, and he just happened to be there. He didn't know what was happening to him, I think, because all of a sudden we wanted his expertise used a great deal. We have corporate partners. Are there people in the industry, in the food industry, who can help the association meet its goals, and how do you do that, and how do you manage that so that you are doing that in a corporately responsible way for both parties? One of the biggest resources you will have are your customers, which are the consumers. We do this work to help people, and so those people are so important, so they become a resource for us. Products and services that we have, in Ethan's presentation you heard about publications and our website and how do you have those kinds of services and resources for your members. And lastly, I call them the electronic connections now. There are so many different ways to connect through social media and different things that all of that can have an important place in our work. So in building the association community, there are 3 or 4 different places where I think you really need to focus, and I will go through these quickly because many of them we've talked about today already. Research, I've mentioned this, it's been mentioned several times. Besides the basic research about nutrition and the core knowledge, there are things like practice audits. What do people do when they're working? What do dietitians do in the workplace? So you have to learn what those people are doing because that will help you develop projects for them. What else is going out in the environment? What's going on in the business world? Right now around this whole world, there's huge financial situations. So how does that impact how you can deliver service and how you can do that, and how does it affect the services you can offer as an association? public health. The public's health is so important, and how in our people in each country, that needs to be defined. You have to understand the public health. You might have somebody doing that. The health minister was here this morning, but you need to know that information and use it with you in the profession. And then, what is your profession's value? Have you determined a value statement so you can go out and market the profession to people? So that's an important thing you can do in research. Education, we've talked a lot about today, and I think you've heard all three of these. Having the competencies that you need to practice. Make sure you are thinking about lifelong learning and how it's going to fit into the association, and use that. And also, how do we prepare for changing environments? Ethan mentioned that the Academy had a futures conference. What they tried to do is sit down and predict the future. They didn't have a big glass ball to look at, but you know, what are the things, by using some of the resource information we have, that we can think, this is going to change, so we need to prepare dietitians to work in that environment. One thing that happened in our country is dietitians were mainly in healthcare. All of a sudden, there's a lot going on in nutrition in the restaurant industry. Everybody looked at the data, and 51% of the food dollars in our country are spent on food eaten away from home. So what is that? That's eating out and using supermarkets and all of that. So are there job opportunities of how a dietitian can work in that environment? Lastly, practice, certainly important. We're all doing this to get to practice, and so we must know that we have common practice standards. We've heard that today. Influence our public health policy in our country, and develop our public image. Who we are, what our dietitians like, what do we look like in the community, when someone meets a dietitian, is that person proud to say, I am a dietitian, this is what I do in practice, and this is how I help our entire country be a better country. So that pride in our public image is so important. And lastly, I put in collaboration. I'm also going to talk, there's going to be talks about this as we move along in the next couple of days. But you are the voice of the profession in the association world. You help form the networks. Advocacy is so important, and Anne mentioned that. I can't mention it enough. Public policy and how you work with your standards that are set in your country for issues related to food and nutrition cannot be ignored. You must be interested in that or part of your membership. And lastly, communication systems. We have to know how to use all the wonderful communication systems that are out there. We're all using them personally. We talk to everybody around the world now, but we need to use them to also promote the information we have in the field of dietetics. I put this in at the end because I thought, you know, they've really accomplished so many of the things I had in my talk when I looked at the kind of points of interest of what you wanted to talk about. And this morning these were mentioned, and I bring them back, that these are the things you've already defined, so you are so far ahead. Now, though, the goal is to make it happen, and that's what all of you are going to do together as you become dietitians and become part of the association. Now, lastly, I'm going to show a little video. Where's my, oh, he left me. Well, I don't know that I can get, I have my AV friend. He said, oh, don't worry, when you get to that point, I'll put the video up. So I have this slide up, but not, let's see if we can find him. Here he is. He's been wonderful to work with, so you have a very good technical person. Where did we put it?
That'll be a good question.
You put it on today's thing. You moved it over to today's list. Practice, ADA practice, I think it said. Ah, there it is. Volume. Will it play?
Oh, so you have a sound too.
No.
That is good to try.
We're probably going to have a great video and no sound. I think. Oh.
Did you know that you can find dietitians virtually any place where food plays a role?
Should we start again? He's going to start
Some
it
of the
again.
places.
Let me tell you, this little video, if you remember Ethan talked about, we have a little video library. Our members can use these. And we put this together because we have a hard time sometimes explaining what is a registered dietitian, what do they do. So this is a little video we put together, and I thought it was a good thing because it covers lots of the different places we practice, and I thought that would be good for you to maybe see today. Okay.
Hello, I'm registered dietitian Bethany Thayer. When people hear the term registered dietitian, they often think of someone who simply helps people lose weight. Did you know that you can find registered dietitians virtually any place where food plays a role? Some of the places you'll find registered dietitians include hospitals and other healthcare facilities, helping patients, doctors, and nurses understand the role food nutrition plays in the healing process and managing diseases. Food service operations in hospitals, schools, and correctional facilities, developing healthy meals that meet the nutritional needs of all. Sports nutrition and wellness programs, helping athletes, coaches, and trainers understand the connection between food, fitness, and health. Community and public health settings, teaching families how to eat healthfully and improve the quality of life for older adults and those with special needs. Research labs, looking to answer critical nutrition questions and find alternative foods or nutrition recommendations for the public. Universities and medical centers, teaching tomorrow's health professionals the sophisticated science of food and nutrition. So whether you're training for a marathon, battling an eating disorder, managing diabetes, recovering from an illness or trying to prevent one, or simply needing help navigating your grocery store shelves, registered dietitians are there to provide you with the personalized nutrition information you need to accomplish your goal. To learn more about what a registered dietitian can do for you and to find an RD in your area, visit www.eatright.org. Encouraging you to eat right, I'm registered dietitian Bethany Thayer.
I want to mention Bethany is just a member of the American Dietetic, whoops, there's our old name, the Academy. She took on the job to be one of our spokespeople, so she's had a little media training, but technically it could be anybody in this room that could have gotten up and made that video. I think she did a really nice job, so I thank you, and I'm going to be on a panel this afternoon, so if we have questions, we can take them at that time, and I think now we are ready for lunch.
Yes.